A crown is like a little hat that goes over the tooth. Whenever there's quite a lot of destruction to the tooth, sometimes a crown is the best way to preserve what is left. The story of a tooth is, if you have decay, that will be restored with a small filling. That filling will last a certain length and will need to be replaced by a bigger filling. Each time the filling is only going to get bigger. As time goes on, there is more trauma to the nerve of the tooth, and after a certain amount of time, the trauma will irritate the nerve and you will need root canal treatment. Before that happens, and before there's too much of a filling inside the tooth, a crown is the option in which to prevent the tooth from breaking, prevent the nerve from being traumatized. So whenever there's a medium-sized filling there, then the next option, or a potential next option, is to put a crown on the tooth. What a crown is like a little hat that goes over the tooth that protects the remaining tooth structure. If there's not enough remaining tooth structure, then you have to sacrifice the nerve, do root canal treatment, put a big screw down into the tooth, and then add a crown onto that. So if you have a medium-sized filling in a tooth, we do know that filling is not going to last forever, and we do know that the best way to protect the tooth in the longer term is to put a crown on. Here we have teeth. This is a crown, and it goes over the tooth, surrounds the tooth, and holds the tooth all as one. Whenever you have a root-filled tooth, because the root filling will render the tooth brittle, you need to put a crown on it to help protect that. Before it gets to root canal treatment, sometimes it's better to put a crown on in anticipation or in prevention of that necessity of doing root canal treatment. There are different types of crowns: porcelain crowns, porcelain bonded to metal crowns, and gold crowns. Gold crowns would be the thinnest crowns available, and as such would be the preferred option of dentists. This is because gold crowns can be made very, very thin, and they're very strong. However, most of the public don't want to have a gold crown, and they want to have a tooth coloured crown. So therefore then you're left with a choice of porcelain or porcelain bonded to metal crowns. You have to take away a little bit more tooth for a porcelain crown or a porcelain bonded crown, and therefore the amount of tooth reduction is increased. Here at Gallagher Dental, we, through our digital dentistry, can do crowns in one visit, where we take a digital impression, we can mill the crown, and we can fit it on the same day. These are Emax or porcelain crowns. The purpose of a dental crown is to maintain the remaining part of the tooth. Because the crown goes completely around the tooth, the only area where there is potential decay going to happen is where the tooth and the crown meet, and that is at the gum line. If you've good oral hygiene and not too much, and if you've good oral hygiene and good diet, there is no real reason for the crown to last 20, 25, 30 years. The more tooth that is available to crown, the prognosis of the crown is better. If there's very, very little tooth to support the crown, then the crown is not going to last as long. So realistically, 15, 20, 25 years is a good barometer for the length of a crown. Dental crowns can be replaced. The reason for replacing them is if they break, if they come off. But again, if you have sufficient tooth onto which to put the crown. They should not come off, and there should not be decay underneath them, and there should be no need to replace them. With more recent advances in dentistry, crowns are now bonded to the tooth structure, and as well as being cemented, they're bonded, and therefore the integrity between the crown and the tooth is superior than it might have been 5-10 years ago. Dental crowns are tax deductible at 20%, which means that you will get 20% back of your tax on the total cost of your crown. The procedure for doing a dental crown is you're numbed up, some of the tooth is removed to make room for the crown, an impression or a digital impression is taken, and that impression is either sent to a laboratory or the crown is made in-house. If it's sent to a laboratory, the laboratory will take around about 3 weeks to make the crown, or if it's done in-house, it can take 1 week, or it can even be done in 1 day. Whenever the crown comes back, it is cemented onto the tooth or bonded onto the tooth depending on the cement system, and the bite is checked. The contacts between the crown and the teeth in front and behind are checked. Once the crown comes back, we cement or bond the crown into place, checking that it is both functional and aesthetic. If you'd like to make an appointment at Gallagher Dental, you can do so by phoning us on 01 678 8158. Alternatively, email us at info@gadental.com, or you can visit our website and book online. The website address is www.gaadental.com. We look forward to having you as a patient, and we'd love to see you and hopefully have a long and rewarding relationship with you.